Mum was in hospital on this occasion because she'd had 3 falls in 10 days. So the hospital decided that she wasn't able to go back to her independent living. She needed some extra care. So a residential home was the only option, basically. You know, we were grateful when I got a phone call from CHS. It's quite daunting, really, because it's quite a big issue, isn't it? Because you don't want to put your loved ones in the wrong environment. So to have somebody do the legwork for us, make all the phone calls, and keep us informed 2 or 3 times a day. Yes, there's a room here. No, unfortunately, there's not a room there. You know, within the constraints that we'd given, was fantastic. So you know, can't speak too highly. Yeah, we're really grateful.
It makes it very streamlined for a care home manager. What I've found is it's just one central point of contact. They have a lot of external people, such as the hospitals, social workers, all feeding into them. And so that when they contact us, they've got a more well-rounded picture of the resident that might be able to be placed into the home. As a home manager, you don't just look at a resident per se, you look at how that resident fits within your care home. How, you know, your room availability, and can we meet the needs of that person if they move into that room? And I think by having CHS, you can transition people within their, you know, with their needs a lot better. You know, it helps support the hospitals with the, you know, the term of bed blocking that we all hear. It is just a faster process, and to only have to call one person or a team of people that you actually already have got a relationship with is a lot better than trying to find social workers in the community that might not be in their office, or you might not be able to get hold of them, to trying to contact a hospital where, you know, the demand on them is so great. To have that focal point for everybody who is trying to support a resident is a lot easier. I think the best thing with CHS is they're fluid and they're flexible, and they're just collating all of this information. And so if for some reason a hospital doesn't know what care home, for example, that this resident might be going to, they're going to contact CHS and CHS will know. To be honest, I mean, for me, I don't understand why it's not all over the country. I'm not sure where it is. All I know is how it works in Baines, and the team are really open. They're very transparent and very forthcoming with information. And they will also, if I don't know something, will go and if I will say to them, could you find that information out for me? They're quite happy to reach out into the community and gather that information for me as well.
Having CHS enables the social workers to complete patient-centred assessments, spending time with people, and then passing over finding the care homes and care agencies to the CHS team. I think it would be fair to say that initially there were concerns from the social work team about how they would interact with CHS and how those relationships would develop. But I think what has clearly shown is that these relationships have happened and that the two teams are working very closely together. I think that two teams being based in the same office enabled conversations, maybe the concerns to be openly discussed, and to iron out, you know, what the social workers would be doing and what CHS would be doing to enable that to work together.
So I think integration is really about relationships between people. I think that the relationships between CHS and the teams across health and social care in Bath and North East Somerset are really strong. And I think they've spent a lot of time building up those relationships. So whether that's with care homes, whether that's with the different members of the teams here at the RUH, the ward staff, or at the community hospitals, our social work teams, for example. Everybody works for different organisations, but we're all working really hard to support patients and people to you know, move through hospital as smoothly as possible, and CHS really help us to do that. As we did more work with them, we realised that there were benefits that we hadn't actually anticipated. So benefits including closer working relationships with our care homes, more trust between hospitals and care homes. So we've learnt a huge amount in the past 18 months working with CHS. I mean, far more than we expected to learn. We've learnt about our care markets, we've learnt about the quality of our discharges, we've learnt about things that we can improve for people coming out of hospital, and we've tried to apply that across not only just our discharges from hospital but across our whole system. So I think my message to others would be to know what the concerns are in your system and to try and think about different ways of addressing those concerns, and also to be open to the wider benefits that you might not necessarily expect at the start, and to bring those in and really make use of those through the work you do.